Welcome back to Wellness Wednesday with NEC Extension. I'm Caitlin Jesperson, the Family and Community Wellness Extension Agent for Williams County. April is Child Abuse Prevention Month. It's a time to observe the importance of families and communities to work together to prevent child abuse and neglect and to promote the overall well-being of children. There are several events happening throughout the month to help provide education and bring awareness to child abuse issues in North Dakota. The impacts of child abuse and neglect last a lifetime. There are many factors that can change how abuse affects children, including the child's age, developmental level, type of abuse, duration or frequency, and severity, but these are a few of the long-lasting consequences. Physically, abuse can cause vision, motor, or cognitive impairments, poor physical health, leading to chronic diseases such as heart disease, diabetes, high blood pressure, and cancers. Psychologically, it can cause poor mental and emotional health, social difficulties, and academic difficulties. Up to 80% of adults who have been abused experience mental health issues such as depression, anxiety, eating and substance disorders, or suicide. Behaviorally, they can indulge in risky behaviors, delinquency, drug or alcohol abuse, relationship difficulties, and repeat abusive behavior. Abuse victims are 1.5 times more likely to use illicit drugs and are more likely to repeat the behavior as adults. Economically, the estimated average lifetime cost per victim is $210,000, which includes in healthcare, special education, criminal justice, welfare, and loss of productivity as an adult. So what is child abuse? North Dakota law defines an abused child as the person under the age of 18 who is suffering from serious physical harm or traumatic abuse caused by other than accidental means by a person responsible for the child's welfare. Harm is defined as negative changes in a child's health, such as causing or allowing physical or mental injury, including excessive corporal punishment. A neglected child is defined as a child without parental care or control, substance, education, or other care necessary for the child's physical, mental, and emotional health. If you suspect it, how do I know when or how to report it? There are several occupations that are considered mandated reporters, which means that they must report any suspected abuse or neglect, even if it's in the past, or face criminal charges for failing to do so. These include any medical professional, educator, counselor, religious or clergy personnel, child care worker, law enforcement, or social worker. However, any person having reasonable cause should report. If you suspect abuse or neglect but are not sure, report it or discuss your concerns with the county social service office. Reporting it allows the social service agency to evaluate the situation and provide support for the families. If you're worried about the outcomes or retaliation, any person who reports in good faith is immune to liability and can be kept anonymous. The best outcome is to correct any issues through education for the parent or caregiver and to keep the families together with the child's best interests at heart. To report, the state toll-free call line is 1-833-958-3500. This is the Child Abuse and Neglect reporting line. Events this month. Every Friday, help spread awareness by wearing blue. Every Thursday this month, from noon to 1:30, there's free virtual series with experts. April 4th is Child Sexual Abuse Prevention. April 11th is Safeguarding Children Online. April 18th is Being My Best Self So You Can Be Yours. April 25th is Connections Matter. So please join us online for a free virtual series. April 16th is an in-person event in Williston. From 6 to 7:30 p.m. at the LB Church in Williston, we're having a presentation on keeping children safe from sexual abuse, with education and conversation. To sign up for those events or learn more about child abuse prevention, visit these websites for more information. The Prevent Child Abuse in North Dakota website at pcan.org and the North Dakota Health and Human Services website for Child and Family Services, which is the hhs.nd.gov. Until next time, continue extending knowledge and changing lives with NDC Extension.